2006年ガーナを訪れた時の内閣総理大臣小泉純一郎氏は一人の日本人に思いを馳せました。野口英世。アフリカの地で東洋人として初めて科学者として名を成した野口英世は、黄熱病の研究のため訪れたガーナの地で自らも黄熱病にかかり、51歳でその生涯を終えました。野口英世の死後、国際社会における医学は急速に発展します。しかし他方では、現在も克服できない多くの疾病が存在しています。今こそ野口英世の意思を受け継がなくてはならない、そう考えた小泉氏は、アフリカの地で病気と闘う医学研究者、医療従事者に与えるノーベル賞にも匹敵する賞を創設しました。それが野口英世アフリカ賞です。
本当に嬉しいことで、日本がこういうことをするのかということで、さらに評価が高くなっているのは間違いないですね。日本がそんなことしてくれたのっていうことで、ものすごく喜んでいるということが会う人ごとに言われるので、もう本当に嬉しいことだと思いますね。受賞した人方々の喜びの声がね、やはり周りに広がっていくことこそがね、そういう人たちがやはり日本のことをパートナーだと思っていることがすごく嬉しいなと思います。これはもうぜひ続けてほしいし、こういう形のものをね、やはりこれからも小さくてもやっていくことがすごく大事じゃないかなと思います。
実は今現在もアフリカでもう2億人3億人かかるような病気っていうのは普通にありますし、先進国では感染症がなくなったように見えるけども、実はアフリカではまだまだ多くの人たちが治療すれば治る、予防すれば感染しない、そういった病気っていうのがまだまだあるんですね。その健康、ヘルス、医学っていうものに焦点を当て、でまたその研究開発と実際の医療活動をしている二つの面で、きちんと素晴らしい方に賞を与えるっていうのは、これは素晴らしい特別な賞だと思います。
野口英世アフリカ賞の授賞式はいずれもアフリカ開発会議 TICAD の機会に合わせて開催されています。それでは第5回受賞者の皆さんをご紹介しましょう。 DNDi顧みられない病気の新薬開発イニシアティブ。設立以来、国際的なパートナーとともに顧みられない病気で苦しむ人々のために、アフリカ睡眠病などの致命的な疾患に対して安全で有効かつ入手しやすい価格の治療法を開発・提供し、低中所得国を中心にグローバルヘルスの改善に幅広いインパクトをもたらしました。また、主にアフリカの流行国の研究機関や専門家が参加するネットワーク、ハットプラットフォーム等を通じて、僻地での国際的な品質基準に即した臨床研究の実施等の成果をもたらしています。
This prize is shining a light of millions of vulnerable patients and communities around the world. In a world where global health is less and less supported at the international level, we see this prize as a strong commitment and strong support from the Japanese government all around the world. More specifically, in continents like Africa, where we see neglected tropical diseases having a big burden for communities, we have done great achievements. A very good example is sleep and sickness all around the African continent. We are working in other neglected diseases like visceral leishmaniasis. Many other diseases deserve our attention, but the most important is to bring the best science for the most neglected patients.
アブドゥライ・ジムデ博士。30年間にわたる研究成果は、マラリアの治療と制圧の改善に大きく貢献し、アフリカ各国政府や WHO の保健政策にも 重要な影響を及ぼしました。幼少期に兄弟をマラリアで失うという悲しい体験が、ジムデ博士がアフリカの人々の生命を脅かすマラリアの研究を志すきっかけとなりました。博士は今もマラリアのないアフリカという夢の実現に向けて尽力しています。
On the clinical development side, I'm working on novel classes of anti-malarial drugs. Currently, the main drug is artemisinin, and there are cases of partial resistance in East Africa and in the Horn of Africa. So we need to be prepared and to find a new class of drugs that would work should the parasite become resistant to artemisinins. That is really information that there is no more reward than hearing villagers say that since you started working in the village, children are not dying anymore. That's the kind of moment that keep us going. So my intention is to I'm already planning on ways to invest this funds to bring more opportunity to more young scientists to be trained in basic science, so that one day, in addition to testing drugs that are invented by others, our young people can invent new drugs and new vaccines to fight diseases in Africa.
第1回から第4回受賞者の皆さんをご紹介しましょう。ミリアム・ウェレ教授。40年間アフリカに住む人々、特に女性と子どもの保健・福祉の向上、コミュニティにおける基礎医療サービスの提供に尽力してきました。
Currently the Chancellor of Moi University. Since receiving the prize, I have been invited to many other bodies. I am a member of the Champions for AIDS-Free Generation in Africa. My focus has been on community health. We must focus more on promotion of health like nutrition, as well as preventing disease, such as through immunization and through hygiene. And this is one way that Africa can control how much money is spent in the health sector. So I would like to encourage young medical researchers and young medical service specialists to really be committed on health prevention, health promotion, as well as being good clinicians to provide good services to our people. Hospitals don't change health, they treat disease. Thank you very much and best wishes.
ブライアン・グリーンウッド博士。30年以上にわたりアフリカでマラリアをはじめとする感染症の多角的研究と実践対策を行っています。
So I'm very honored to be one of the two first recipients of the Hideo Noguchi Prize, and I'm very grateful to the government and people of Japan for establishing this prestigious award. I considered how best one could use the considerable sum of money prize money that comes with this award. I thought that the best thing to do would be to establish a scholarship program for young African scientists that would allow them to undertake a master's degree. During the past 5 years, over 4,000 applications have been received, and it's been possible to make 30 scholarship awards.
アレックス G コウティーノ博士。HIV 感染者の7割が住むアフリカにおいて、感染者が治療を受ける機会を増やす先駆的な活動を行っています。
I received this prize in recognition of the work that I and many others had done in scaling up HIV services. Since I received that prize, I have now applied the knowledge that I have accumulated over 35 years as a doctor in scaling up medical services to new challenges. It's important that prizes like the Hideo Noguchi Africa Prize are supported and encouraged, because it will encourage the younger generation of Africans who are coming up in the field of research and medical service delivery to aspire to one day also be recipients of this prize.
ピーター・ピオット博士。HIV やエボラ熱等アフリカ大陸の多くの地域に存在する疾病について中心的な研究を行っています。
Receiving the DNDi Africa Prize was definitely one of the highlights of my career. In the first place, because Dr. Noguchi is a truly universal role model for all of us in global health. And I trust that the prize now will attract the best of Africa's researchers so that their work can receive all the support that is needed.
フランシス・ジャーバス・オマスワ博士。保健従事者の教育、研修、定着及び移住を含む世界の保健人材危機への対処、またアフリカをはじめ世界での人材重視の保健及び医療制度の構築において多大な貢献をしました。
Since the award, I have continued to work at the African Center for Global Health and Social Transformation, focusing on strengthening health systems in Africa, community health services in particular, and also on strengthening human resources capacities in African countries and creating movements here in Africa which support health workforce. Part of the money and the substantial amount has gone towards building, constructing an institution which is named in memory of our daughter who died in her early 30s some years ago. It is called the Frida Omaswa Health and Community Institute. It is intended to support strengthening of health systems and educating and training new generation of health workers who will contribute to strengthening health services not only in that area but also in the whole of Uganda and Africa.
ジャン・ジャック・ムエンベ・タムフム博士。エボラウイルス病等の研究及び疾病対策の人材育成において多大な貢献をしました。
So the Hideo Noguchi Prize remains a great symbol of the visibility of African research. And this visibility is a stimulus for future generations of young scientists. The most important areas of my research is Ebola, and also the second field of activities was Mpox. Mpox was a neglected disease in DRC. It was an endemic disease in DRC that was neglected. But since the outbreak of 2022, the multi-country outbreak, Mpox was declared by WHO as a public health emergency of international concern. So we conduct pioneering activities on this virus that is now public health emergency of international concern.
ギニア虫症撲滅プログラム。カーターセンターの主導のもと、政府、NGO、国際機関等さまざまな組織との協力によりギニア虫症をほぼ撲滅させました。
I think it would be an understatement to say that the Hideo Noguchi Prize awarded to the guinea worm eradication program and the Carter Center has been a phenomenal change maker in helping push the effort to eradicate guinea worm disease globally forward. The success of the global program to eradicate guinea worm in part makes it difficult to finish the job because we went from 3.5 million people each year with guinea worm to only 13 people at the end of 2024. So now you are really looking for a needle in the haystack as you try to make sure that this disease cannot come back and attack people. And so it's thanks to the Hideo Noguchi Prize and the people of Japan that we were able to push that forward.
サリム・アブドゥル・カリム博士およびカライシャ・アブドゥル・カリム博士、 HIV エイズ予防治療への世界的貢献、アフリカ人研究者の育成、そして新型コロナウイルス感染症対策等に大きく貢献しました。
It's a great way to affirm and acknowledge his contributions, but also that this prize is focused in Africa where it made significant contributions, and to recognize African science and excellence is deeply valued in Africa, showing the role African science is playing not only in addressing challenges in Africa but also globally.
In addition to continuing our research on HIV, we now play an important role in supporting a range of different initiatives, and one specifically right now is on the Mpox situation in Africa. We are involved in Mpox research and supporting the Africa CDC in their efforts to respond to this problem before it becomes a major global challenge. The Hideo Noguchi Prize has played an important role in our research. It has funded our research on broadly neutralizing antibodies, a way in which we are developing a new technology to prevent HIV, and it has funded several students who are now doing higher degrees and developing themselves as researchers in Africa.
日本はこれからも野口英世アフリカ賞を推進し、アフリカに住む人々の保健と福祉向上への協力を呼びかけるとともに、グローバルヘルスの分野において主導的な役割を果たしていきます。